Hey guys, thanks for being here today. I want to talk to you today about optimal healthy living. And one of the things that we do at Optimize You is we have a strong passion to help people understand how do you take what years you have left on life and really live it to the fullest, to become the best version of yourself. And so we're going to talk about this. And one of the things that's really important from a standpoint of where we're at in society is there's a lot of controversy. There's a lot of confusion on how do I age well? What should I do? What medication should I consider optimal for the way that I live my life? And then also, what about foods and lifestyle and behaviors and things of that nature? And so I just want to kind of give you an overview of some things that are a little bit controversial when it comes to hormone replacement therapy. So when we talk about objectives, one of the things I want to kind of help you when you leave here is understanding what are the benefits of hormones? Why should I even consider it from a standpoint of lifestyle? And then also I want to talk about why all the controversy? Where does the controversy come from, and what should we do, or how should we think about it differently? And then I want to bring us to full circle. Where are we now? So looking at controversial topics that have been in the past, and then where are we now, present day, and how does that apply to me? So when you talk about hormone benefits and functions, I just want to give you a brief overview. Hormones are something that's produced. It's a chemical messenger that's produced from a gland, and it has a direct effect in various parts of your body. And that can be production from the ovaries, which in females is going to produce things like estradiol or progesterone or testosterone. For men, it's going to be the testes, which produce testosterone. So we're looking at those hormones and how they have benefit. And these things are critical to our life. They actually help the formation of DNA and transcription. So it is very important from a metabolic standpoint. It also obviously determines gender differences when you talk about what hormones are doing. And it also helps us just the vitality of life. One of the things that we talk about a lot is we want people to have a vibrant life. And we do that through hormone optimization so that it improves your energy, improves your mood. Optimal levels are essential for health benefits and overall quality of life. And so we'll kind of describe the difference between the common way to handle hormone decline versus the optimal way in just a second. Specifically, when we talk about hormone therapy in our realm from an Optimize You standpoint, really what we're looking at is sex hormones. And so I'm going to just give you a brief overview of those. Estradiol, progesterone, testosterone, DHEA, those are all required for us to have proper growth, proper maintenance of the tissues throughout the entire body, but specifically within the sex hormone realm. It helps to maintain brain function and health. It helps to build our immune system. These hormones can also help with connective tissue, so our skin, our hair, our nails, how those things function. It improves our insulin sensitivity, or how our body metabolizes different things. It also improves blood pressure, so it has a cardiovascular benefit, these hormones do. And then it also decreases cardiovascular disease. So there's two major issues when it comes to hormones as it relates to the process of aging. And here's the first one. Number one is that all hormones are going to decline. So as we age, it is a natural process of declining of those hormones. For women, you guys will see that occur during perimenopause, which is that 4 to 10 year window prior to menopause where the ovary really stops to function. And at menopause, those hormones are pretty much completely gone. For men, it's more of a natural progression or a decline over time, somewhere that starts in our mid-20s, early 30s, and beyond. And so we start to see these declining features in these hormones. You can look and see, I think the last data that I saw, 15% of the American population, as an example, is on a form of a thyroid hormone medication because it is such a prevalent issue. And so you can see that there's some subclinical hypothyroidism. But every human, male, female, is going to experience some type of decline when it comes to hormones. But the other thing that I think is really important is that we really just don't understand it. So you've got this natural progression or declining effect of hormones, but then the reality is when we are looking for help or we're looking for answers, what happens is we go to these medical clinics and we ask, hey, I don't feel great, I've got these issues. but we're not heard because when we get evaluated or we have these labs done, what often is told to us is that, hey, everything looks normal. And so we have this idea, and something we say a lot at Optimize You is that normal is not optimal, because what we want you to understand is that you are not to compare yourself with the average population, especially in the United States. If you just want to take some specific statistics, for example, 74% of Americans are either overweight or obese. So you always want to know, who am I being compared to when it comes to these hormones? And so you really want to have the understanding that normal is not optimal when you're talking about labs. And the other thing that is something that's really important is, one of the things that we talk about a lot is we want to treat symptoms, not just the number. A lot of times when you look at the traditional medical model, most of the medical model says, hey, what is the lab value? And that is the diagnostic tool that is then used to either treat or not treat that patient. And so what we want to do is we want to actually listen to the patient. We want to help you understand what are the symptoms that you're complaining of, and then correlate what those labs show to help us really develop a treatment protocol that benefits you from a standpoint of what your symptoms are, and use those labs not necessarily diagnostically as much as from a correlation standpoint to support what it is that you've got as a symptom. And so the common view that we face, and that as a society that we face, is this idea that natural declining of hormones is something that you should not mess with. It is just a natural process of life, and therefore, because of that, you should not do it. I would also argue that there's probably some agenda behind that, because when you look at how the declining effect of hormones affect us from a medical standpoint, there are some financial incentives to certain pharmaceutical companies because of those declinings. So for example, if I'm hormonally imbalanced or declining in my estradiol or progesterone as a female, then one of the things that's going to combat that is I'm going to become more insulin resistant. Well, isn't it interesting that Big Pharma has opportunities where they've got drugs to treat those symptoms, but they're not really treating the root level, which could in truth just give you the hormones that you've lost. And so one of the things that we have to kind of combat is just this common view that the decline of hormones is just a natural process that you don't want to mess with. But really the optimal view is this, and this is what I really want to bring home today, is that aging overall is really self-destructive. It is going to happen, right? I don't love the terminology anti-aging. I don't think that's really the appropriate thing that we should use. I think what we want to do is we want to have a healthy aging process. We want to live the most vital life that we can from a quality standpoint, from a health span standpoint that we can, as we continue to age until our time is done. And so we've got health span and we've got lifespan, and we want to really kind of focus in on how do we enhance the individual's health span so that however many years you have left, it is the best years that you've got on this planet. So it is a natural process, but we want to optimize that. And then you look at the characteristics or the progression of what we call chronic diseases. And in the United States, even though we spend more money on healthcare than any other country in the world, we are probably one of the sickest countries in the world. And so here we are spending all this money, and yet we are not really solving the problem. And most of the things that we are spending this money on is chronic disease. Prior to the 1950s, just an example, less than 5% of all healthcare dollars went to chronic disease management. Now, almost 95 to 98% of healthcare dollars go to chronic management of disease. So what was initially created with healthcare for sick care, acute care, I'm sick, I need an antibiotic, has now turned into how did we just manage these diseases that we've kind of self-inflicted upon ourselves with lifestyle behaviors and dietary restrictions and those kind of things. And so we want to have the ability as providers to really give the patient the understanding that this is the time for you to take ownership of your health and fight against some of these chronic diseases that occur. And you can do that not by waiting for these diseases to happen and then now I'm rebounding and I'm taking a diabetic medication, or I'm taking a blood pressure medication, or I'm taking a statin. But instead, what could I do on the front end to really help myself age well so that I can take ownership of that health and really resist the onset of chronic disease. And so that's just the mindset that we have at Optimize You, where we want to help you become the best version of yourself. We want you to take ownership of your health. We want you to live a vital life. We want you to have a vibrant life so that you understand the optimal view for healthy aging.